Thank you for the introduction. So how to live with ITP. So this is my perspective then. So I always say to my ITP patients, you know, your goals in life, we can nearly always reach them. So don't let ITP stop you. We can nearly always find a way. That does depend on what the goals are, of course, but you know, most realistic goals, go for it. You know, we can together get through these things. Really important, don't sit around in an armchair waiting for things to happen. You'll wait a long time for those things to happen and won't get anything done in the meantime, so don't do that. This is something I always tell my sons, never stop being curious. Ask questions, never assume you're getting the best treatment. So, you know, every time you go to your doctor, ask them questions. They'll enjoy the interaction, you know. You enjoy people asking you questions, having a to and fro, rather than just having a sort of one-way conversation. I always say bring a family member or a friend with you to appointments and give them permission to ask questions on your behalf. You know, they'll think of things you don't, and if you know, and they'll pick up on things that you may forget. You know, quite often a lot of information is exchanged when you go and see your doctor, and I think sometimes, you know, I think I've given a really clear message, but maybe it's not as clear as I thought. But if you've got two people on your team, you know, communication's going to be better. And finally, my own little pet thing: try to avoid steroids at high dose and for long term. I hate using steroids, and you know, there are so many alternatives. Always ask about steroids if you're on them for a long time. Just some general little bits and pieces now. This is all about living with ITP and what you can do. So these next few slides, I've got a family friend who has ITP. I'm not the doctor because he phoned me when he got ITP and I said, look, I probably know you too well. So he goes to a colleague of mine for treatment, but I did ask him about this because he's a senior officer with Border Force. In terms of taking medication away with you, like particularly overseas, this means there aren't that many restrictions on what you can take overseas. But going into other countries, there may be restrictions, and these particularly relate to certain types of drugs, like opiates, benzodiazepines, things like diazepam, and things like medicinal cannabis. So medicinal cannabis is something you absolutely shouldn't be taking to certain countries, like Thailand, for example. So it's always good to really look at the information on the website for countries you're going to in terms of what you can take. And there's some countries that if you're on certain drugs, you probably just can't go to. It's going to be too hard. The TGA itself, which is the Australian Therapeutics Goods Administration, they say they can't give you specific advice about going to other countries. You've got to check with that country. And the important thing to remember is, you know, it's always good to take a stock of medication. So if you're delayed while you're traveling, you've got enough you know, for a bit of a contingency supply if you're held up. But you are not allowed to take PBS medication sort of months worth, because they have been subsidised, you know, by the Australian government for your use. And in theory, I suppose, people could be taking these drugs overseas and selling them. So taking an excess of drugs away will raise suspicion potentially, and there is a fine of up to $11,000 or 2 years imprisonment if you are found to be illegally carrying drugs that are not for your own personal use. It's always good to carry a letter from your doctor. It's not absolutely necessary all the time, but you will never really go wrong if you carry a doctor from your letter detailing your prescription medicines. And they should include the name of the medicine, how much you're taking, and it's for your personal use only. If you're taking complementary medicines, it's good to get those included on the letter because, again, you know, people are not entirely sure what you're bringing in, so if you detail what you're bringing, that's a good thing to do. This is what my friend in Border Force told me. It's best to carry, if you are carrying medication, it's really best to use medication if you can in blister packs. Don't pop the medications out into bottles because anyone can put anything into a bottle, and what the label says doesn't necessarily relate to what's in the bottle, whereas to forge a blister pack would be an incredibly complicated exercise. So if you can take a blister pack, Or if the medication only comes in bottles, a clearly labelled bottle with the sticker on with your name and, you know, all those things that it comes with. And again, don't pour all your meds into the same bottle and know what they look like and take them all, you know. Keep them separate. So like I say, don't pop drugs out of blister packs or mix them. A labelled Webster pack, so that thing with the tick on it is the sort of thing that chemists will make up for you. And it's like a made-up blister pack. It's hard to kind of forge one of those. I think they come at a nominal cost from the chemist. The thing people often use is that thing with the crossfire where you pop your own drugs out. But again, anyone can put anything in those packs. So if you can get a Webster pack, if only for the overseas trip you're taking, that's a lot more acceptable to the sort of border force type people, both in Australia and other countries, because the chances of you kind of doing something sneaky are a bit less if it's some kind of official looking thing like a Webster pack, which is this and not this. Like I said, you want to take a small backup supply, but like if you're away for 2 weeks and you're carrying 3 months of medication, that could cause suspicion that you're actually taking the drug out of the country to sell or something like that. Again, if you're really only taking one medication and it's got your name on it, it's all printed up, you probably don't need a doctor letter, but you never go wrong by getting a doctor letter when you're going overseas with medication. Travel insurance, as you know, it's hard to get travel insurance cheaply for a pre-existing condition. But if you don't declare a pre-existing condition and then try to make a claim against it, you know, you could be in a lot of trouble in terms of actually having your insurance claim met. So it's good to declare your pre-existing condition. It's important to know, and on the next slide, that there are many countries that have reciprocal healthcare arrangements with Australia. And what that essentially means is if you need emergency healthcare in those countries, it won't cost you anything. And similarly, for people from those countries coming to Australia, it won't cost you anything. And there are some quite nice countries on the list. So there's a few to pick from, you know, and you can just go there with confidence that the healthcare in the public sector hospitals is going to be free to you. USA, needless to say, sadly, is not one of those countries. And last time I was in US with my family, we went out for a lovely dinner at a restaurant in Santa Monica, and my wife ate something and had an allergic reaction, and her lips swelled up, and her tongue started swelling up, and we thought, oh no. So we phoned the hospital switchboard, and it was going to be $700 just for the hospital, just for a doctor to come without actually doing anything like prescribing any medication. So actually my wife refused rather than me and said, go to the pharmacy. So I went to the pharmacy down the road, and in California there's quite a lot you can get from a pharmacy without a script. So we managed and saved ourselves $700. Unfortunately, my wife is still alive and well. Now, if you've got ITP and you're travelling, despite what I've just said about steroids, I hate prescribing steroids, but if there is one drug that's going to act quickly and reliably in getting platelet count up, it probably is steroids. So if you are going to take a little stash of medication with you, then probably prednisolone would be the thing. Again, I wouldn't be taking it for long term. I'd say short term if you really need it, because it's the thing that's probably going to work. And you're treating doctor contact details, you know, so that people can get in touch with us. You know, if I've been managing a patient for a few years, I know exactly what they respond to and what they don't. You probably do as well. But people like to contact your doctor rather than take your word for it. So, and generally speaking, emails are useful, particularly if you're somewhere where the timing is not good. Like if you're in Europe or USA, the timing doesn't necessarily coincide well with our working day. So your doctor's email is always useful in this situation. So reciprocal healthcare arrangements I've mentioned. So London is a place you can go in the UK. So these are a list of countries where you can go and get reciprocal healthcare. So there are some great countries on that list where you can go free in the knowledge that if you really run into problems, the healthcare you can get will be provided free of charge. That is not kind of long term, that is just emergency to kind of fix the immediate problem. So there's the list of countries. I've been to all of them. And I can highly recommend, there's not one there I wouldn't say is not a great country to visit. I think these talks are available, aren't they, so people can get that list? Yeah. Flying. Okay, so we often get asked about flying. I know of absolutely no reason specifically why you shouldn't fly with ITP. So there is a risk of infection. An aircraft cabin is a relatively small space full of a lot of people. The last 2 times I've flown to Europe, I've got COVID both ways. There was all this stuff during COVID that said that the cabin air was changed every kind of 3 minutes or something and going through high filtration. I mean, that may be the case, but there is no standard for cabin filtration on planes. So although some airlines may make that claim, if you're going with different airlines, there's no standard in the aviation industry for cabin air filtration. So I would say, look, if you're worried, wear a mask. You can still get masks very easily, and they certainly do provide some protection. Blood clots is always a problem. As you probably know, despite the fact that ITP is characterised by low platelet counts, there is a mildly increased risk of having blood clots. And then, of course, you need to use blood thinning medications, which can be a problem if your platelet count is low. So we really like people to avoid getting blood clots. So the thing is, in a plane, the humidity is very low, so you lose, just through breathing, you lose fluid. People tend to sit down and not do much. If you drink alcohol, that dehydrates you. So the thing to do, I always say, is drink as much water as you can. If you drink loads of water, you have to keep getting up and going to the toilet. And that's good exercise, just getting up and moving. And try, the other thing, it's very difficult on a plane to avoid alcohol because people keep trying to give you alcohol. But just say water, and they'll give you water. So in every airline magazine that you get in the seat pocket, there's some kind of little thing about exercise, what to do, wiggle your feet around. So if you follow that, that will be good. So those sorts of things, just keep active, keep hydrated to avoid blood clots. When the plane takes off and lands, you'll all be familiar with all the little kids on the plane starting to cry. That's because of the pressure change, and you can get barotrauma, so you can, worst case scenario, get a perforated eardrum. Once it's perforated, the pain goes away, but it's in the process of that pressure building up and it popping, it's quite painful. It's not a specific problem in ITP, but and you can hold your nose and blow out, make a funny face, and that kind of helps you equalise the pressure. If you have ITP in this plane crash, it probably makes absolutely no difference whatsoever. So don't worry about that. If you have any medical condition that is really unstable, and you might, require medical attention on a flight, and particularly a long flight, just don't go. One of the things I've been asked probably 5 or 6 times, as you get the tap on the shoulder, they say, "Dr. Bird, what kind of doctor are you?" And you just think, "Oh no." And you feel like saying, "I'm a geologist," but no, you think, no. There may be no other doctors on the plane, I better be honest. And the paramount question, so they want you to attend to the person, but the really important question the pilot wants to know is, do we need to get down? And invariably with me, it seems to be we're flying over like Kazakhstan or Russia or somewhere like that. And my answer is usually no. But obviously, if you felt there was an emergency that you had to get down quickly, you would say get down. So I would say, if you've got ITP, I really can't think of any reason you shouldn't fly. Some simple measures, as I say, just with a bit of exercise and hydration are good, but there's no reason why ITP should stop you flying. So just in terms of having things done if you've got ITP, safe platelet counts. So in our guideline, it's not actually in the main article that you get to immediately, it's called supplementary information. So we've published a list of platelet counts, and I'll come on to these tables in a minute, that indicate what is a safe platelet count to have procedures done. So the important thing is always let your doctor or dentist know you've got ITP. If you know what your platelet count is recently, let them know. It's probably good to get your platelet count checked to make sure it just hasn't dropped down a bit, or is surprisingly good. But in emergency situations, just ask the doctor or dentist to liaise with your treating haematologist if the platelet count needs to be improved, so you're not delayed forever. So if you're going for a dentist, basically a platelet count, like tooth cleaning above 20, simple extractions, which are usually front teeth, above 30. If it's a molar or wisdom tooth, generally above 50. And if you're getting an injection for a nerve block, which you usually get if you get a deep filling or something like that, above 30 is advised. If they do extractions, tranexamic acid is anyone who's got problems with an increased risk of bleeding. Tranexamic acid is your friend. It's a really good drug that's very low risk of any problems. But if you're using tranexamic acid, you can get a mouthwash, but if you put it in your mouth, rinse it around and spit it out, it really isn't going to do much good. The thing is with tranexamic acid, it's a drug and it needs to be in contact with a clot to have good effect. So if you're having teeth out, you get gauze swabs, you soak the mouthwash in it, and then you put it up against the tooth or bite down between your two jaws so that there's prolonged contact with where the tooth has been removed from. If you're taking it as a tablet and you're having extraction, I'd usually say 1,000 milligrams 3 times a day for 3 days is usually enough to reduce that risk of bleeding after the tooth has been removed. For operations, I mean, obviously this isn't something that you will determine as much. It will be the surgeon really that will be mainly making these decisions. But generally speaking, for minor surgery, a platelet count of above 50. If it's something like a skin excision, it really doesn't matter. The platelet count it's just got to be above 20 because it's something where you can compress the area like a small skin blemish removal or something. Major surgery, getting deep into your belly or into your chest or something, it's generally advised that the platelet count should be above 80, and then for surgery on the brain or on the eye, above 100. These, as you can guess, these are all round numbers, so there's not a great deal of evidence or studies that say these are exactly the numbers. These are ballpark figures, but they're useful as a guide. But again, always recommend that your treating haematologist is consulted about these things. And this is just a whole list of little procedures, again, with platelet counts. I won't go through them, but these slides will be available to you afterwards. And these are just a general guide to the sort of level you should be aiming for the procedure to be conducted safely. If you run out of medication, so people do this all the time, it's surprising how often people run out of medication. There are some treatments that it's very inadvisable to stop treatments quickly. So steroids, if you've been on them for a long time, it can actually be quite dangerous to stop them, because what happens if you're on steroids for a long time is they shut down your body's own ability to make its own steroids, and you can become acutely deficient, and that is a very dangerous situation to be in. So if you feel like you're going to be running out of steroids and say you've got 3 days left and you're out of contact with the world for a week, if you cut down so that the tablets you have got will tide you over so that you don't just stop taking them. So try and cut down to kind of extend the supply you have got until you're in a position to recharge your supplies. So as I've said there, halving tablets or even taking tablets every other day so that you don't have to stop cold. Also, the thrombopoietin receptor agonists, so romiplostinol trombopag and avatrombopag, if you stop them suddenly, we're not in a usually in a life-threatening situation, but you can get this thing called rebound thrombocytopenia, where your platelet count can really drop abruptly. So it's inadvisable to stop them without really discussing this with your doctor. But again, if you are caught somewhere, if you're off in some remote part of the world, and Australia's got a lot of remote parts in the country, and you're cut off by floods or somewhere like that, again, try and reduce the dose so that you don't just stop suddenly. So for example, if you're on, avatrombopag 20 milligrams daily, maybe go to 20 milligrams alternate daily so that what you've got will last you until you can get back and get your supply topped up again. As I said, it's really not a good idea to make any change in your long-term medication without discussion with your doctor. So I'm certainly not advocating that you do these things really. These are just sort of emergency situations. And, you know, as I said before, if you're travelling overseas, if you're going out camping somewhere remote, you know, just take a little bit of a contingency stock with you so it will last you a bit longer than the trip is intended to be, so that if you cut off, you're not going to be running out. Vaccinations, it's tricky with vaccinations. There's very good evidence in children that ITP can follow vaccinations, most commonly what's called the MMR vaccine, measles, mumps, rubella. The evidence for other vaccines is less clear. And remember, during the pandemic, around more than 98% of the population had a COVID vaccine. And we did not see an increased rate of new ITP diagnosis during the COVID pandemic. I think we are all, those of us who look a lot of ITP, we all think we did have some cases probably triggered by the vaccine. Maybe they behaved a little bit differently to people who would have got ITP through other causes maybe. Difficult to say. What we did look at is we looked at sort of people, who'd had vaccines and what happened to their platelet count, and we found around about 20% of patients dropped their platelet count, around about 20% went up, and about 60% didn't really change. And Dave Kuter looked at a group of his patients as well from the northeastern US and had similar sort of figures. I certainly have some patients that I mentioned earlier that have relapsing, remitting ITP, and sometimes vaccines, like flu vaccines, seems to trigger a relapse. And you know, it's really tricky if you really think a vaccine has triggered a relapse, because then what do you recommend every year? Because the really important thing about most vaccine preventable diseases is the actual disease is going to cause you worse trouble than the vaccination itself. So in general, I would have to say that as ITP hematologists, we generally do recommend vaccinations. So there are some vaccines that are very good at preventing diseases, and there are some that are not very good at preventing diseases. So the COVID vaccine is not very good at preventing diseases. It's said to make any infection you get possibly milder, but you know, there is a very good antiviral treatments available for COVID vaccine. So again, if you're concerned about vaccines, speak to your doctor about those and sort of get some advice as to what vaccines are really protective, what have a slightly higher risk potentially of causing infections, and what don't. Blood donor. So we know that ITP is caused by platelet antibodies, and we know that if you transfuse blood into someone who didn't have ITP from someone who did have ITP, that you will get a drop in the platelet count. So people with ITP can't be blood donors. And this is a famous experiment in hematology called the Harrington-Hollingsworth experiment. Look at what it did to this young man. He went in looking like this, and he came out looking like that. See? And a platelet count. Now, the other interesting, I always point this out when I give this talk to medical audiences. This was in the old days before they had machines that did blood counts. And 800 was regarded as a completely normal platelet count when they did the counts differently. Now you would say, gee, this person's got a condition where they produce too many platelets. But anyway, platelet count fell right down within a day to undetectable levels, and then over a few days recovered. But for this reason, people with ITP can't be blood donors, because the antibody can be transfused and it can cause someone receiving the blood product to drop their platelet count. So even if you're in remission, you know, your platelet count's above 100, you could still have the antibody present that can cause this. So people with ITP can't be blood donors. Diet, I'm not really going to say anything here because Phil has essentially covered this. Exercise, if your platelet count's reliably over 50, really, other than avoiding impact sports, I would say just about any exercise is good for you. So boxing and rugby, horse riding, motorbike racing, things where people try to injure each other are not good. And people where, you know, like falling off a horse, falling off a motorbike, that's probably something I wouldn't do if my platelet count was potentially low. But if your platelet count is generally over 50, there's really not much you should avoid. Regular aerobic exercise just improves general fitness, which helps in managing any chronic disease. So if you're generally fit, you will manage anything better. And there is excellent evidence, I should say, that mental health is improved by regular exercise. So any kind of exercise is generally good for you, and gym work is generally safe. So people often ask about gym work, weightlifting. Again, generally safe. But always ask your treating haematologist again if you're going to be starting up some new exercise or going to a different level, because I don't want to say you can do anything you want and then something terrible happens. Now, I had an incredible sense of deja vu when I was doing all this, and then I remembered in the dark days of COVID, Daniel and I did this sort of interview, and it was covered a lot of the same material as this. So there is a video on the ITP Australia website. It was called Answering Some of Those Common Questions, and we did this interview 4 years ago now, where we covered similar material. So again, there's a few videos on the ITP website, but something that covers very similar ground to this is on the website, so you can look it up, as well as the slides that I've presented today will be available. So that's I think that concludes my, there was nothing about income tax. There was nothing about the neighbour's dog barking, the challenges in life we all have to meet. But this is hopefully some ITP-specific things that we've covered. So,
thank you, Dr. Bird.